Welcome everyone to today's webinar. Today, my name is Graeme Dykes. I will be your moderator through today, and we're very excited to be launching some of our industry partners, what we are calling the Exchange. And we are going to take the next hour to understand a little bit more about what we're talking about, frame the problem, frame what the solution looks like, and frame the value, and why we believe that this could have a significant benefit to the current situation of COVID-19 as well as beyond. And again, I'm your moderator. I am the Managing Director of the Healthcare Transparency Initiative and look after healthcare for Resilinc. And if you don't know Resilinc, we are a supply chain risk management on the broad level, but we are a software and data company that specializes in resiliency and business continuity and obtaining that necessary visibility and transparency for anyone involved, any stakeholder involved in healthcare, whether it's a manufacturer, GPO, distributor, or the providers themselves. So today I am very excited to announce our panelists today. First, we have Amanda Chabla, who is the VP of Supply Chain at Stanford Healthcare, who has over 15 years as an influential leader across supply chain executive leadership in healthcare organizations, managing level 1 trauma hospital, academic medical center, community hospital, private practice, and responsible for over $1 billion of non-labor spend across the enterprise. Successfully saved $150 million in expense reduction through cost reduction strategies and effective sourcing, value engineering, streamlining processes, establishing partnerships while building strong clinical and executive partnerships. Before, she was the VP of Ancillary and Support Service and has responsibility across a variety of departments such as perioperative, imaging, radiation, oncology, and more. Welcome, Amanda. Next, we have Sean Powell, who is the Group VP of Premier and leads the disaster preparedness and response team, as well as the product disruption team at Premier. And I'm sure most know Premier is a national GPO with over 4,000 acute hospitals and 175,000 non-acute facilities in their membership. We also have Bindya Vakil, who is the CEO and founder of Resilinc. She is a practitioner in supply chain and founded the company about 10 years ago, solving many of the issues that we are facing today in healthcare. I won't, most of you probably know Bindya. She has been recently quoted in HBR, on Bloomberg Radio, and is very well respected for her knowledge in the actual operationalization of supply chain resiliency. And then last but not least, we have Wes Wheeler. And Wes is the former CEO of Marken and was appointed president of UPS Healthcare in 2019. He's in charge of expanding UPS's healthcare services with key investment partnerships and technology that address unique customer needs in the healthcare and life science markets. UPS Healthcare is dedicated to providing comprehensive global supply chain management, cold chain, specimen logistics, and other critical healthcare service operations. During his 40-year career, he's been involved in every key functional area in pharmaceutical, including manufacturing, drug development, supply chain logistics, marketing, and engineering. Has a BS in mechanical engineering from Worcester Polytech and MBA, emphasis on finance. And most importantly, lives in North Carolina, as do I. So welcome everyone. Again, super excited about what we are about to share today. So let's dive into it. So the first few slides, we're going to be talking about framing the problem, and I'm going to be turning this over to our panelists for the most part. But as we know, COVID-19 has brought, this pandemic has brought such significant scale to the problem that we've probably never seen in our lifetimes. And with that has created a set of issues which we are all have been scrambling and working 24/7 to try to minimize the impact of this virus. And in doing that, what we've highlighted in this middle column here, the first one of new cases, is just showing the total number of new cases that have happened a few days ago. But then on the right side, we're also talking about those that are seriously or critically or in need of critical medication and supplies. Now, this does not take into account all of those people who have come into the hospitals or into facilities to be tested. And so this is just talking about the scale of the problem that is being felt by the individual hospitals. And I turn this over to Amanda and say, Amanda, what are you seeing on the ground here? And could you talk to the number of cases and the sheer scale?
Yeah, no, thank you so much. So I think we all recognize the fluidity of the situation and how extreme it is. Even from this data alone, I'm looking at the numbers, 43,000 is what we had said yesterday afternoon. And as of this morning, the number of new cases in the United States alone is over 50,000. And so not only are we growing exponentially, this only represents truly the number of patients that have turned positive. It doesn't represent another 60, 70% that are coming into the hospital and being cared for that are testing negatively. And when we're looking at supply consumption and utilization, the consumption is much larger than even what's modeled here. This is only reflecting the positive PUIs. It does not reflect the actual healthcare needs or the workforce for medical supplies and equipment.
Yeah, thank you. And I think that dovetails nicely. Amanda, just keeping with you here, this was I believe, a Harvard, an HBR slide that kind of shows through the different levels of potential infection across the U.S. and the needs for basically hospital beds and the servicing of these of the patients. Do you feel that this is accurate, and what does this graph tell you?
Yeah, well, I think when we look around the world, we see countries such as Italy, such as Europe, other areas that are trending towards this way and have exponentially grown. And I think that's also why many states are mandating social distancing and to really essentially bend or flatten the curve, as we've heard about. And it's unclear as of today where we are on bending the curve in various pockets. I think we'll have a better idea in the next couple of weeks. There's many models that are going on and predictions. This is one of them. And the key here is if we don't figure out as a nation how to solve this together, and we are only looking at our individual community, we're going to end up at that 60%. And that's not only from a social distancing perspective, but also from a supply chain perspective, because the demand is outpacing the supply.
Awesome. Sean, what is your take? From a GPO, you look across multiple health systems and of course across all the supplies and have a great pulse on the market. How do you interpret this?
First, Graeme, I just want to start and say thank you to Resilinc and team for coordinating the efforts, and I'd like to congratulate and thank Amanda and all caregivers and all providers across the country for the tremendous work they're doing. No doubt that we are facing unforeseen and certainly unprecedented levels of stress, not only on our caregivers, but also on the supply chain. And so as we think about the impact on the supply chain for this, there's several different statistics that we can reference, and I think much of the work that we're doing with Resilinc is to help try to prevent proactively where we are potentially going to see these risks moving forward. And so there's the risk today, there's a risk that maybe could have been anticipated yesterday, and then there's the risk for tomorrow that we're trying to mitigate against. From a supply chain perspective, there's no doubt that we've seen unprecedented levels of burden on the supply chain. One key statistic that we've discussed in this group is that there's over 2,600 unique SKUs that are on allocation across the country, which is a statistic that we haven't even gotten to within 10% of across the history of Premier. And so as we think about how that impacts the supply chain, it also impacts suppliers and providers. And when you think about Amanda at Stanford, obviously a teaching institution that likely has a long history of ordering those products, but there's many non-acute facilities or smaller facilities that don't have that same history of ordering these products in the same scale. And to that end, they're really struggling to be able to identify what is going to be my source for these products. And a classic example of this was with our friends up in Washington and the long-term care facility that was sort of the epicenter of the Northwest breakout. And that location didn't have a history of ordering that PPE. And so as we think about that and think about all those other long-term care facilities and non-acute facilities that are going to be funneling these potential patients that Amanda suggested into the system, we really need to be able to identify where there is product in the system, where there's demand for that product, and make sure that those two match up.
Amanda, back over to you. Yeah, if you look at the number of just the hospitals and available staff beds, and could you kind of paint a picture for the audience here as to, this is, Sean's just articulated well what you're dealing with. How do you extrapolate that to 6,000?
Yeah, so when I think about 6,000 hospitals across the United States, just take a minute and just imagine and close your eyes and think about the power and the influence of what we can do if we were in an interconnected and an integrated network that allows hospitals, clinics, providers, supply partners to connect in a network to create an exchange in which we can move products, move where the greatest needs are. We as an industry need to fundamentally or move away from the historical allocation models. It doesn't work. It doesn't present the reality of what we're facing when we're in a situation of a pandemic and an epidemic. Especially as we saw in the earlier graph, there's pockets today, but those pockets are vastly growing and vastly spreading. So how can we as a nation come together and create an exchange that addresses the shortages, that addresses the hoarding that's occurring, and rationing, and being able to exchange as one kind of entity or one United States, thinking about our local communities, but also thinking about broadly. That's really what this really represents, is imagining the possibilities if we had an exchange that was large enough that would represent all the states.
But I do appreciate you framing that for us. And then, you've drawn this picture looking at the United States, this just tremendous ability, but also opportunity for us to interconnect. So that opportunity, though, could you dial that back down now to Stanford and what you deal with on a day-to-day basis and why this is the need? Can you walk us through some of your pain points currently in being able to seek inventory from fellow health systems and being able to manage through this process?
Yeah, no, absolutely. I'll get into the tacticals. As organizations began, some as early as January, February, March, beginning to increase and procure inventory, most organizations, not all, live in a just-in-time world where we keep a limited amount of inventory on site or through our distributors. And when we have the supply disruptions and the magnitude of not only the disruptions, but the demand, our challenge really is the type of inventory anyone can procure. And so I at Stanford may be challenged with a certain product category, and one of my colleagues down the street may be challenged with another product category. And really what this is about is an exchange that allows us to be able to talk to each other, to be able to say, I've got 3 product X's, I've got 4 of product Y, and allow for that exchange to occur. Think of it almost as essentially what I say, a dating app, where I can say I've got this brand of N95 because that's what I've been able to procure on the market, but we recognize that, there are sometimes regulatory standards and so forth, and in this example, OSHA requirements in which the N95 has to be fit tested. And think about the waste that would go on if we were to refit test the workforce versus having the exchange to reach across the states and say, do you have this other N95 and can I truly trade you? I'll share a personal example. As early as yesterday, actually, there was a need. There's a great shortage of testing supplies. Stanford had some swabs, in which another academic medical center needed, and we needed a certain size of N95s. And so what it is today is people picking up the phone locally to their own local hospital to hospital, and saying, I'll give you this if you give me this. Now, what this exchange really does is allows us to take it on a very global scale, in a much more broader way, in which we can share, here's what I have, here's what I need, and bring things together in our interconnected network.
Thanks. Sean, I'm going to go back up to this slide and ask you for your input here into, again, you have that unique vantage point of being able to see very broad, very deep. Do you see the same thing that Amanda has just articulated for us? Is this something that all health systems, all hospitals, both small, both large, I mean, are they equally affected? Could you give us a little bit of insight?
I'd be happy to, Graeme, and I'll use a couple of historical reference points. Again, I think this current state that we're in today is a reference point that our children or our children's children will probably refer to in the history books as one that will go down. But I'll refer back to Ebola. And when Ebola broke out in the United States, the CDC's direction was that there was going to be one central location across every state that was going to be the epicenter for that state. Should a patient present, they would be taken to that location. What that led to was 50 different states having 50 different health systems that all hoarded to make sure that they were prepared appropriately so for their patient populations. When we had the first patients present in New York and Texas, what that led to was a lack of product in those locations, and frankly, a bolus of product in 48 other states. And so this concept of a clearinghouse or an exchange isn't brand new, but it is put into effect by Resilinc in a way that has never been done before. And with that, between the approach that we're taking today, which is all the med-surg distributors are putting all these products on allocation to try and protect that same output that we saw during Ebola, which is to protect the purchasing history of those facilities to make sure that they had product should they need it. And we're seeing failure in that system as well because of the fact that as Amanda and myself and some of her counterparts have discussed, if you have a history of ordering 500 masks, and then there's another facility that has that same purchasing history, one of you has 100 patients, one of you has none, you're going to get the same allocation. And so we need to continue to think about how do we pivot our allocation process and our distribution process across this country. And so whether you're a small hospital or a level 1 teaching institution, the purchasing history is not indicative of need, it is indicative of your purchasing history. And so this is, again, demonstrative of why it's so critical that we continue to think about innovative solutions like this as an industry, and why we're proud to launch this exchange. And I will also say that this isn't about Premier doing this. This is agnostic to all GPOs because it's appropriate for what's needed in the industry. And so whether it's Stanford, who we're excited to work with on this project, who's not a Premier member, or our own Premier members or an HPG member, is irrelevant. The thing is we've got to find solutions, especially during times of need. And again, excited about the solution that has been brought forth here.
Yeah, thanks, Sean. So, yeah, you talk about that allocation, and now you're talking about 2,600 products that are on that list today, probably growing tomorrow, right? And maybe segue that to Wes. Wes, again, maybe we can get a different vantage point on this from the logistical aspect and the movement of product. How I don't even know how to put my mind around it or wrap my mind around it or my brain around it. I'm not sure what you say in the United States here. But Wes, could you just frame a logistical picture for us?
Sure, thanks. I mean, just to give a little bit of background. UPS, of course, one of the largest transportation companies in the world. We move over 20 million packages a day through the network, almost 500,000 people. We have 16 GMP qualified facilities in the US alone. We have the ability now through our network, whether it's through the airline network or the overnight network, or even through our GMP network, to position products anywhere in the US, move products between any site in the US to any other site in the US within 24 hours, most of the time before 10:30 the next morning. So the capabilities are quite vast. We are more than just a brown truck company. We are quite a broad-based transportation and clinical and actually commercial supply chain company. So what we're doing right now, and what I'm in the middle of at the moment, is working with FEMA. We have an embedded logistician up in Washington now, sitting in the FEMA headquarters, working out these what they're calling pop-up sites in 47 locations around the U.S. It's going rather slowly right now because of some bureaucracy that's happening up there, but we are participating with them. We're trying to offer our services, not only to bring test kits into the pop-up centers, but also bring samples to the 6 approved CDC laboratories around the country. That has morphed into more of a state-run initiative. So the states are now getting involved in setting up their own sites. We're now working with 2 states actively, and we expect to be working with more than 10 states by the end of this week, doing the same thing, positioning PPE and supplies and materials, test kits, and whatever else is needed to set up these sites. We're positioning those in 3 warehouse locations right now: California, Louisville, Kentucky, and Pennsylvania, in order for us to stage and manage whatever materials are required at these sites as they pop up. So we're very actively involved right now, and looking forward to continuing to help the country in any way we can.
Thanks, Wes. We're just honored and blessed that Amanda, to take your vision and try to bring this to fruition, and to be working with such awesome partners here. And as Sean says, this is for healthcare. This is not for any one entity or any one individual or one group. This is something we want healthcare to be engaged in, and this is what we're going to share today. So pivoting a little bit quickly there, because we've still got a lot of content to go through, is to Bindia. I'm going to introduce Bindia to the conversation now. And Bindia, we have started on the slide, but again, now that we've framed this problem and the scale and the ability, we have the transportation side, we've got the healthcare side, we've got the GPO overview side. How do we bring this from a technology perspective, from a feature perspective? How do we bring this to market, and what are you looking at accomplishing from a tech perspective?
Yeah, thanks. And thank you all for joining. And Amanda and Sean and Wes, thank you all for participating today and for your vision and support. This all started with when Resilinc has been obviously doing a lot of webinars and tracking the supply chain problems since January. And we've been doing biweekly webcasts on all the projected shortages and issues. And over the last few weeks, we started to see healthcare loom as one of the biggest constrained industries in all of our work, and growing, because demand is not destroyed. There's the opposite. There's a huge demand surge expected. And so we've been internally trying to figure out how can we add value. In the meantime, Amanda and I got on a call a couple of days ago. We both know each other through an ASU advisory board project. And she started to talk to me about the struggle she was having. And I recalled a conversation I'd had with Sean from a couple of months ago. And so we just kind of started talking to each other. And within a few hours, this concept was born. What is needed for a solution like this is you need to have a cloud-based infrastructure that is secure, where Resilinc has that. It's a multi-party connection network where customers connect with their suppliers, suppliers connect with many customers. So many companies are all collaborating on Resilinc with messaging, the ability to have a data model that transfers from a supplier level to a site level to go down to a part or product level, and the ability to have a structured data flow as well as unstructured messaging and all of that. Resilinc is a trusted membership, right? So we are connecting companies with other trusted companies that they do business with today. And so we had a lot of the key infrastructure already in place that we were applying for the process of risk management and risk mitigation. It was just not connecting in a peer-to-peer network to conduct a product level exchange. But the essential elements were all there. Once I talked to Amanda, we brought our chief technology officer on board, and literally within a couple of days, the architecture was created. And the team was very, very honored to actually be part of the solution. And so we at Resilinc were unanimous about this, that we don't want to charge for the exchange during the COVID response. We want there to be no barriers to solving this problem. And we're just humbled that we can be able to contribute everything that we have worked towards for the last decade. In fact, just donations to talk about, as our customers are many of the top companies across high-tech, life science, semiconductor, medical device, pharma, aerospace, defense, food, etc. Many of these companies, and it came as a little bit of a surprise initially, but a lot of semiconductor companies have clean rooms and they use PPEs for those clean rooms. So some of our customers started calling us as we started talking about the exchange and saying, hey, we're interested in donating some of the PPEs that we have, as well as obviously with so many life science medical device customers and their suppliers as part of our network. Resilinc is in a very unique position to bring together a lot of parties to create a donation center as well. Now, we are very clear our role is that we're a technology platform. We're enabling the connections, but we don't want to play God, and we don't want to be the ones deciding who gets what. And so a couple of things that we are looking for is some participation from government sources so that the disbursement of donations and supplies can happen effectively. What we know is that the exchange and the Resilinc network can provide tremendous value in getting us, getting this technology deployed through the cloud, through this networking infrastructure. We have connected nationwide ecosystem of hospitals. It's fine, Graeme, if you stay on the.
Yeah, no, I was sorry, Bindi, I was just going to say, Sean, don't you have some statistics on donations coming through non-traditional healthcare means into some of the hotspots where this actually does have some scale?
Yeah, the city of New York has aggregated and collected 300,000 N95s over the past, well, as of last Friday, so over 5-day scale. So that becomes material, especially when you're talking about a burn rate of close to 3 million masks, upwards of 3 million masks per week across that city, and a strategic national stockpile that as of last week only had 15 million masks total in it.
It's great to see everyone coming together. Bindia, back to the exchange.
Yeah, so we just want to make sure that the disbursements of the donations, we have some help and support from the right agencies, and we welcome the ability to collaborate with the right partners that are doing this command and control and disbursement at the national level. So I just want to put that out there. I think over the next couple of days or weeks, we will have a little more information to share as we go through the next few months. In general, Resilinc is offering for all U.S. hospitals up until September 2020, which is hopefully our window for resolving or at least having some kind of an idea of how this our success rate and flattening the curve. We're all hoping we can do that. So as of now, we hope that up until September 2020, we're all able to use the exchange and gain value, hopefully save a lot of lives if we can successfully, exchange resources between hospitals through this platform. Resilinc exchange is also open to all the distributors, hospitals, and GPOs that are Resilinc customers, and also Resilinc customers who are in the life science, medicine, medical device, pharma, and other industries, as well as, like I said, semiconductor and high tech, and other companies where you might have items to donate. We welcome your donations. So please let your customer success managers know that you may have donations that you could contribute to this. I think we do have a vetting process, so I just want to be, and we have the, at the end of the webinar, we will be able to send out the link for the pre-registration along with more information, but we will be going through an approval and verification process that will involve us checking with one of our ecosystem partners. We're very cognizant of the fact that the exchange needs to be a network of trusted people with nobody abusing. Sometimes we over the last few days as we've built this, we have been concerned. Sometimes you feel like no good deed goes unpunished. And so we don't want to be a case study of that. We want to be a case study of how this platform, this exchange has been used for good. And so we're very careful about who we let in, and it will need to go through a vetting process, and I will talk about that in the next couple of slides. Amanda, or maybe Amanda, you could talk about this, your idea of some of this, if you would, and then Sean, before we go into screenshots.
Yeah, no, that's great. Thank you, Vindhya. I think this is phenomenal. First of all, that Resilinc is bringing this to the market and bringing this in such a way in which access is not a barrier. I'll go back to the concept of, and I'll use this analogy. It's almost like a dating app where it connects one organization with another with the haves and have-nots, where one organization can say, these are the items that I have a surplus of. These are the items that I need, and being able to connect it at such a global scale of 6,000 plus hospitals versus our current small networks. And being able to do that in an area or at a time where we have a significant pandemic and it's going to continue to intensify, and we need to rise together, and we need to have an exchange that works in unison across the nation. So we can support not only our local community, but fighting COVID-19, fighting the pandemic as a nation. Even if one community is successful, we will not be successful unless we do it together. And that's really the idea behind this exchange, is allowing for that communication, allowing for that collaboration, and that connection where one can be connected to another based on the needs within the organization.
Sean?
Do you have any input in that?
The only thing I would like to add is, obviously, this is built with the most benevolent of intentions, and we all agreed that it was more important to put a structure together that would allow us to get some of this product accessible through the exchange as early as possible. And so I think when we think about the structure of it today, and Vindhya will spend some time talking about this versus what the future state will look like. The only other thing I would say is that we do need to empower this with data, including purchasing data, historical data. And so as we think about the ability to demonstrate holistically that there are, in fact, those facilities that have gaps and don't have access to product versus those that are just interested in gaining product. My fear early on in this is that you'll have a lot of people seeking product and not a lot of contributors. And the power of this is going to come long term as we continue to build out the platform. And so I would just encourage us all to be patient as this occurs. But if you do have a meaningful contribution and a means of doing so, and an ability long term to be able to share some of the data that I think will make this meaningful, then I think that you've got a very meaningful, robust tool that Resilinc has created.
And you've got all these allocations coming right behind this, right? It might be with masks, gowns, boots, and things right now, but tomorrow's going to have its own set of problems as well. So I think this is going to be here for a while. So thanks. I think the word that comes to mind here is I just wrote it down as everybody in, right? In order to do something that's bigger than ourselves and individually, we've all got to play our part and to resolve this problem. And it's just fantastic to see such great minds and organizations coming together. India, I want to move us along here to some of the quick products and what it might look like and what we've pulled together in a ridiculously short period of time. And Amanda, I won't tell my wife that I'm going to be dating 500 hospitals soon, so I'll try and keep that one quiet.
Yeah, so thank you. So we'll go through some screenshots very quickly. As Graeme said, typically a product development cycle for SaaS is 4 to 6 months. We have basically shrunk that into essentially 2.5 weeks. This is what we're showing you is in theory of development right now. The goal is to get the exchange out mid-April. We're starting to accept pre-registrations already. The goal is as soon as we go live, we will have all the pre-registered products, inventories, offers, and requests loaded. So the day that we go live, you will not, it will be live with data in it. So that you can immediately start to see what products are available, what exchanges are possible, who has the products you are looking for. You'll be able to search by different fields and then find hospitals who may have a product to exchange. We will be very, there are rules so that only 2 types of things are possible. You can offer a one-to-one, meaning, hey, I have this to offer and this that I need. And if you say, I have 5 things I need, you have to have 5 things to offer. But you can offer more if you want. So you can offer 10 things, but ask for 5. Or you can offer 0. So in the case of a donor, you would have no request. You would be basically only a donor. But in case you are requesting, you have to have something to exchange. So if you go to the next slide, just to talk really quickly about the pre-approval process. So the participants, the goal is to make sure that Resilinc vets the participants before the access is provided. So please note that once you register on the link today or in the coming few days, there will be a vetting process we will go through. The vetting process we will conduct in collaboration with our customers in the healthcare, life science, pharma industry, as well as the HTI, the Healthcare Transparency Initiative Board. So Graeme, you can maybe talk about just the HTI. This is something that you lead at Resilinc. Yeah, go ahead.
In the spirit of everybody in, right, it's a very similar issue with how do we understand where our risks in the supply chain are, both in tier 1, tier 2, and beyond. And as we've just realized through all this, we've started to unfortunately learn the hard way. And so the idea is to try and not expose that, but to obtain this data so everyone in the value chain can make great decisions and partner better and stronger for the future. So doing this as an individual health system, which generally doesn't have a huge investment into the supply chain vis-a-vis the clinical side, we wanted to come together under one umbrella and have everyone in to solve the problem. So manufacturers, GPOs, distributors, healthcare providers to come and help to set a standard and help to create the ability to work on this together, understand what brings benefit to each stakeholder at each level, and to try to obtain the necessary information on some frequency to not only surface that information, but to make sure that great decisions can be made, as well as solving this and mitigating this together as opposed to apart. And so the HTI is there just to bring this leadership together in order to try and enact change on a national level for the US. And
so, Yeah, so just to add to that, I think this is our advisory board, our board of directors for ensuring that the exchange is governed well, and whenever there are concerns or issues or any complaints that might pop up, we will be using and leveraging the HTI board to help resolve disposition, etc. But this is kind of our North Star. They will keep us honest. They will keep us on track.
Right.
Yeah,
they hold the integrity of the program together. Absolutely.
Great. So really quickly, just some simple screens just to kind of give you a sense that it's meant to be a very simple, I think Amanda calls it a dating app. Every time I think of it, I smile because it's really simple. We've tried not to include complexity. As I said, this is a product we're building literally within 2.5 weeks. And so it's meant to be, this is what I need. Here are the things that match what my requests are, and I'll be able to track who has those products, exchange. You can see there's a messaging icon, so I'll be able to find somebody who has something that I need, initiate a messaging chat with them, and then we will figure out how the exchange might work. Now, you may find that the item posted by somebody is not exactly the item you requested, but if you find somebody that has something that you need and you have something else to offer but not something that they requested, then the chat is a good way to initiate a conversation and say, hey, none of the stuff you offered is good for me, but I have something else, do you need it, right? So just like Amanda talked about, this process, this conversation is currently happening very manually. Now you can have this conversation with a group of 9,000 hospitals across the country or 9,000 organizations across the country and use technology to connect with a much broader swathe. And even if you don't have like for like to connect, to exchange, start the conversation with someone who has what you need and see what else they might need that you might be able to have in exchange that maybe you didn't list because you didn't realize that that was something they needed. So the messaging we see is a very key thing, and that's something that we have been working on incorporating into everything Resilinc for the past several months. So this was a good way to bring that together in this case. Next slide, Graeme.
Thanks, Bindi. I'm just going to add answer one question there, and these are just indicative screenshots, but we will be able to put in there the manufacturer part number, a UDI, an NDC, as well as like a G10 or that, so we can match and get the closest match possible and make sure we are matching on an exact product. So once we've created this trade connection or this exchange connection between two parties, we have the logistical issue to deal with. So Wes or Bindia, do you want to kind of talk through a little bit about this? And then I'm going to introduce Wes back into the conversation about UPS's role.
Yeah, let me frame it up a little. So when Amanda and Sean and I, when we first started talking about this problem, one of the things Amanda said was, okay, well, we find the people and then we'll have to figure out how to get the logistics executed. And so we have been in discussion with UPS for a few weeks anyway on potential collaboration. And we reached out to them. Philippe Gilbert, who is the president of the SCS Solutions business unit, and Wes were extremely supportive, fully on board with the idea that the exchange was doing good, had lots of potential to be a solution that could help many hospitals, and so they are here today in support. And certainly, just to be clear, hospitals are welcome to use any preferred logistics provider that you might have to coordinate your shipment. We're not dictating any single provider. Having said that, UPS has the reach, and most companies and hospitals certainly may have an account already. And since UPS is working with Resilinc, we thought it would be a really easy way for us to sort of coordinate the exchange, particularly we want to make sure that situations where one of the hospitals ships something and the other hospital, what if they don't, then at least there's some level of coordination between the two shipments. So there are some things that, Wes, I'll be letting you speak in a minute, but there are some things that we have to figure out. It's not like we have a technical integration with UPS. Those are all kind of down the road things that we will work on as we go in the next few weeks, and then give a more seamless experience on the platform. Wes, do you want to cover this a little bit?
Sure. And again, yeah, we know we're not the only game in town. So most people, companies, organizations, NGOs that are on this call, or that eventually join up with this exchange, I'm sure already has an account with either UPS or our competitors. And I think we would promote you just doing what you have to do to make it happen as soon as you can, because we're in a crisis at the moment. We're offering, of course, to help any way we can. We have an email address here on the screen that you can log on to, and we will help get an account set up for this. If you want to have a special account just for this exchange, if you have an existing account, please by all means use that. If you have any other questions, just bring them into this email site. We'll get back to you as soon as we can. And there are features and benefits within the UPS system now that allow you to track shipments. There's this product called My Choice that allows you to see, more visibility on your package as it moves through the network. We could provide also accelerated services called UPS Premier, which guarantees 98% on time, within time, the next morning. So we have quite a lot of choices that you can choose from, but please by all means reach out to us and ask your questions if we can help you set up an account or otherwise.
Thank you, Wes. Very much appreciate your leadership and support in all of this. It'll be critical. I'm just going to talk just real quick about I'll go back to some of these donations, and if you notice there at the top, the UPS Foundation may be able to help with some of the logistics if this is a donation to the exchange. So, we're talking about here about companies who want to contribute. We need to be able to, for the hospitals to find these donors who can, and the exchange obviously plays that role, and make these two parties collaborate and then work with UPS or their other transportation provider. In this exchange, though, especially when it comes to donations, the participants are responsible for all their product. That was one question that came up. We are not validating and verifying the products that are being exchanged. That is between the parties to do that, and the coordination of the logistics, right? So that is the idea, and we will have a complaint ability here to be able to, for any party on here, to be able to share if the other party is not acting responsibly. We're taking that very, very seriously with a lot of vetting, as much as we possibly can on the member side, but on the product side, that is between the parties. And if you notify us if a donor requires monetary compensation, if they fail to execute on a donation, if items are not shipped or unusable, or there's just bad actors in the game, we will be taking that very seriously. And as you say, the HTI board is going to be a party to making sure we set the right rule sets to keep this keep this on the up. We also want to know that what the exchange is not. It's not an e-commerce. We're not trading financial information here. It is not a bidding platform to you to sell, an N95 or K95 for $8. It's not a dumping ground for products, right? It's not a super hoarding mechanism so I can just get more and more of what I need. This is everybody everybody helping everyone else meet the needs of healthcare providers. And it's certainly not the ability to price gouge. We take that very seriously, and people will not be able to stay on the platform if that is the case. And also other questions that come up. It's not free for organization or not customers unless hospitals or a part of HTI or our customer set. And we also want to notice on the bottom right is a further almost philanthropic arm of what we're trying to do at Resilinc is we will offer our event watch free through this period of September 30 for exchange of donations, of certified unexpired products to healthcare providers. So, because we believe that if they are securing their supply chain or more resiliency, agility in their own supply chain, that raises the resiliency of the entire healthcare network. So we very strongly believe that, and actually we've built a company around that single belief. Bindia, can I just throw this over to you for 1 sec, talk about pre-registration?
Yeah, absolutely. So we will start accepting pre-registration today. After this email, all of you who attended will receive the link. And so please help spread the word within your communities, hospitals and chief procurement officers who you know in your network, so that they can have their team listen to a recording of this webcast, which will also be available by tomorrow. So yeah, please do start the pre-registration process. We will begin releasing it mid-April. So we will be accepting the pre-registration. Like I said, all of the data will be loaded. At pre-registration itself, you will be able to upload the products you are looking for, as well as the products you are requesting. And the goal is that the exchange will go live with at least that data loaded, so that the day you start logging in, it's not like a blank slate that you have to start typing into it. In parallel, as registrations are received, my team will begin vetting and getting the approvals out. And then I think there was a question earlier, NGOs and government agencies and any private companies, if you have inventory to contribute, you are welcome to join. If you are not a healthcare provider, you will not be able to request items. Okay, so you can donate. You are welcome to join the exchange as a donor. What we will start to do is we will begin hosting training webinars. So once you receive your confirmation, we will start hosting daily webcasts that you can join beginning April 13th, so that you can listen for 30 minutes. I mean, it's meant to be a simple solution. It's not like a complicated thing. So 30 minutes of your time just to check out how it will work, so that the day you log in, your account is created and you start searching, you can immediately start executing. And so we don't have a training lead time to wait until things can actually happen. The goal here is to start with the U.S. market, because we understand the market. We sit here in the community. We are part of this community, but we know that the need is acute and intense in other parts of the world and growing there. And we are fully cognizant that we need to, if this product is the answer and it's a good solution, that we need to make it available globally. And so we need a few weeks within the U.S., get some key learnings, get everybody up and running, and then we plan to release it in May and June timeframe globally. Go ahead.
Yeah, no, that's great. I know we've got about 4 minutes left, and I think the one question that came through was just on the vetting process. So this is very fluid, but in general, certainly on the healthcare system, we will be doing vetting on the organization, making sure it's legitimate. We will be looking at emails, making sure they are legitimate. We will also be passing it through our customer base on HTI, and as well as the GPOs and the hospitals we have, just to make sure that these are legitimate organizations. Becomes a little bit harder to do on the donation side, but which is why we need to take the time in the vetting to make sure it's correct, and make sure they understand the rules, as well as, I forgot what I was going to say. It left me. But anyway, so they will be, we do have operating procedures for that. Those have been written, and we do have an SOP for how to go about the vetting process internally, and that's been vetted by HTI as well, and members of that. So I think we got room for one or two questions real quick. Jigar, do we have any questions directly from there? I don't see all of them. So, yeah, sorry, they're just coming through. Okay, so I think I can't get access to them right here, right now. I think one of the key questions is on typically people have asked about e-commerce, and that was asked again here. Are we doing financial trades? And the answer is no. We are doing financial trades. We actually expect and hope that our healthcare providers will charge a median. If they're going to do a charge or a trade, it's going to be at median price. And I've actually been talking to many hospital systems around the country about this, and they often know that there is expiring inventory, and they would actually like to donate inventory into the system, knowing it's going to be used by another health system. So we really are starting to see this everyone with an altruistic approach here in making sure patient care is upheld. So I think that's pretty much what we can do. I would like to throw it back to Amanda. She's been silent for a while, and to Sean and Wes. Are there any final comments you'd like to make to the audience?
This is Amanda. I just want to really thank Resilinc for taking this on and really coming up with a platform that is altruistic and that helps us with our fight against COVID-19. It's about us as a nation coming together and looking at different avenues in which we can not only support our local but greater community. And I do think there's an opportunity at a national level, at a federal level, to look at this exchange and leverage it with where the needs are around the country. So thank you. Thank you so much for the opportunity. This has been phenomenal.
Likewise. Sean, Wes?
Wes, do you want to go ahead?
I think that was well said. I don't think I had to add anything to that. That's perfect. We are here to help. We want to get past this as soon as we possibly can.
And my only concluding remark is Sean speaking is, as Bindia suggested, these ideas percolate over time, sometimes over years before they're actually brought to fruition. And for my challenge to everyone that is listening and participating today is to continue to push us to think creatively about these solutions. It's unfortunate circumstances that push us to lead this from ideation through to creation for this particular endeavor, but it certainly will be worthwhile if we can continue to help support each other in thinking through meaningful solutions. So continue to push on us. Thank you.
Very good. Bindia, any final words?
So I just want to say that my team is completely honored and humbled, and I have had emails from our engineers and our designers and others who are thanking me for some reason for giving them the opportunity to work on this product. So we just want to say that Resilinc is completely excited, fully on board, has rolled up our sleeves and mobilized to support this process. There will be questions. There are questions. We will be reaching out to you with answers in the next couple of hours, so give us a few minutes. On behalf of everyone at Resilinc, we thank you for all of the medical professionals and staff who are at our front line. Thank you for your service, and thank you for your bravery and showing up to work and putting yourselves and your families at risk. And despite knowing you are well educated, you know the risk you are taking and you do it anyway, and we are humbled by your sacrifice. Thank you very much for the opportunity.
Fantastic. And with that, I think we are going to end. I'll just end on one. I'll just end on that, and we will be sending out answers to the questions that we did receive, and they were plentiful. So we appreciate everyone. Thank you so much, and we will be in touch soon. bless and goodbye.